who knows that dementia could be preventable? And a lot of people have no idea that there's any idea or any chance that it could be preventable. So, firstly, it's been able to make people aware of the fact that, yes, it can be preventable in certain points. And it can be up to 45% of dementias can be preventable. There's a survey or a report that was done by the Lancet Commission that's been done over several years now. And the latest update was in 2024. It shows the different types of risks that are available. So 55% of it is not preventable because your risk increases with age, and also you're born with your genetics. You can't help those. However, the other 45%, there are about 14 different risk factors that are identified at the moment that could contribute towards it. So these are things like the ones that you might be well aware of: lack of physical activity, excessive alcohol consumption, smoking, those sorts of things. But there's also things that people aren't quite so aware about. So, limited education, brain injuries, air pollution. There is also poor sight, poor hearing, lack of social contact. And then you've also got some of the underlying illnesses that we have. So obesity, hypertension, diabetes, all these things can contribute towards an increased risk of having dementia. Now, just because you have those doesn't necessarily mean, dementia is the next stage. It just means that obviously your risk is there. And there are certain things that we can do to reduce those risks from there.
What is the link between hearing loss and dementia?
So I think with hearing loss, again, a lot of people tend to, if you're not hearing what's going on around it, you're not getting the stimulation with your brain that's coming through. So you find people retract and don't participate quite so much. So a lot of it is to do with the senses side of things as well, because sight as well, if you're not seeing things, your brain has not been stimulated in the same way from there. So there's a lot of early research going into being able to test people for dementia using hearing, but those are all quite in early stages at the moment with regards to research. But I think what's really important is that the research that's been going on is showing that actually as adults, we've all made quite a lot of our decisions about life and how we can take things forward. So they're actually finding out that what we need to do is actually raise the awareness amongst our younger generation and the children where, they might not have fully developed their understanding, they might not have fully developed their patterns in life and their bad habits, and being able to get into there. So it's been really great that, not only discussing it at the conference, because at the conference we had the Director of Public Health talking about this whole idea of risk prevention and reducing the idea of dementia, but we've also been going into the schools. We've been going into a couple of the schools to talk about this whole idea of the risks available so that children can start making informed choice and make wise decisions that may be able to help them in the future and help with the prevention and the risk reduction in the future.